So, as we head into the new year and Omicron surges, where are we and what can we expect? Hi, I'm Dr. Brian McDonough. First of all, let me put this in perspective. I'm a family doctor trying to treat patients like most family doctors, so not an epidemiologist, not doing research, but reading the tea leaves, trying to look ahead. Understanding how the virus works is all part of how I figure things out. Basically been fairly accurate throughout the pandemic just by using common sense. So, again, what I'm saying may or may not happen, but judging from what epidemiologists are saying, they're starting to get to the point where they believe that if you test positive, and remember, we could have as many as 1 million people a day in this country testing positive in a short period of time, how long do you stay out of action? Traditionally, it's been 10 days. That's what it's like in most of the world. And remember, these policies were established when we did not have vaccines or any form of treatment, really. So what are they suggesting now? Well, I'm starting to see a trend where if you test positive and then in a period of 5 days, test negative once, perhaps twice with antigen tests, you might be allowed to begin to recirculate as opposed to 10 days. Now, that is not the policy, but you're starting to see where that might happen. What's the argument for this? Well, the argument is if it's safe, you can get people back to work. You hopefully wouldn't have a depleted healthcare system, or at least you'd have more people at work. You'd be able to not shut down the country. You could keep things going. The argument against it is one that remains. What about the unvaccinated? What about people who have no protection? Remember, if you're vaccinated, the symptoms are not as bad, and it is far less likely you'll be hospitalized or die. But if you haven't been vaccinated, you're fair game for anything. So when do they pull the plug and say it's 5 days and let those not vaccinated take their chances? That's a tough issue when you think about it. Now, me advising patients is to explain that discussion and to say, listen, if you're unvaccinated, do you really want to be a victim of that discussion? It might be time to reevaluate why you're hesitant. In a public forum like this, that's my suggestion. But again, people make choices. Just understand it's going to get harder and harder if you're unvaccinated in a world where many of these protections might be stripped away.